Okay. Okay, we're going to do this in two parts. We're going to talk about the Houston Vision Zero plan first, and then we'll talk about the coronavirus and everything else second. And today I have with me Chief Acevedo. Well, let me start with Mayor Pro Tem Dave Martin, Councilmember Sally Alcorn, Councilmember David Robinson, and then we have Carol Haddett with Public Works. Mine is moving slowly today. And then Margaret Wallace Brown with Planning, Chief Acevedo, HPD, and Gabe Caceres. Where's Gabe? Gabe Caceres. With the Mayor's Office of People with Disabilities. And then David with Transportation. All right, so good afternoon, and thank you all for being here today. In August 2019, I announced the city's commitment to Vision Zero, a strategy to end traffic deaths and serious injuries in Houston by 2030 and improve mobility for everyone who walks, bikes, uses a wheelchair, drives, and takes public transit. After more than a year of data analysis, community engagement, and multi-agency collaboration, we are launching the Vision Zero Action Plan today. Houston has historically been known as a car-centric city, but like all great cities, Houston is evolving. Our mobility policy is also evolving as we shift the way we think about transportation. We are committed to prioritizing people over cars and integrating a variety of transportation modes instead of focusing solely on vehicles. We know wider roads and faster speeds will not solve our congestion problems, and we know that our current roads already contribute to the high number of deaths and serious injuries. Today, traveling on our roads results in over 200 deaths and 1,000 serious injuries every year, and that is unacceptable. We cannot expect to change our mobility paradigm if our streets aren't safe for all of us, and we cannot encourage people to use other modes of transportation if our streets don't accommodate everyone. That is why I stand before you with Houston's first ever Vision Zero Action Plan. This action plan lays the groundwork for a strategy that we can and must accomplish. Before we talk about the specifics, I want to bring everyone's attention to the first few pages of this action plan. Listed here are 1,153 names and ages of people who died in traffic crashes from 2014 through 2018. Each of their names is a reason to end traffic deaths. One name is one too many. Our goals are straightforward: create a safe, equitable, and accessible network of streets, make walking, rolling, and biking safe, make connecting to transit safe, make driving safe. Houston's Vision Zero strategy draws from input from multiple departments and partner agencies, including Planning, Houston Public Works, Health, Police, Fire, the Office of Persons with Disabilities, as well as our partners at Harris County, Metro, and TxDOT, social justice and multimodal transportation advocates, and the private sector. Most importantly, it draws on community input. We received over 2,000 comments, so our community made it clear that safe streets are a priority. They told us that speeding is their top traffic safety concern, and they said that creating a direct, connected network of sidewalks and crosswalks is one of the first actions the city should take to make our streets safer. They told us to rethink the way we talk about traffic crashes. We need to call a crash and stop calling them accidents. Crashes are preventable. The plan presents both quantitative data, including crash reports and traffic volumes, and qualitative data, like dangerous streets and intersections reported to us by our communities. We start by looking at our highest injury streets, our most vulnerable travelers, and our communities that need more attention and investment in their infrastructure. 1/3 of traffic deaths involve a pedestrian, even though less than 2% of residents walk to work. So we start by prioritizing safety over vulnerable road users like people walking and using a wheelchair. Based on 5 years of crash data, we've identified a high injury network of streets with the highest density of traffic deaths and serious injuries. Nearly 60% of our crashes occur on only 6% of our streets. Our data shows 52% of those high injury network streets are in vulnerable communities. This means that our most dangerous streets predominantly affect low-income residents and people of color, many of whom rely on walking or public transit because they don't own their own vehicles. We start by implementing the 13 priority actions identified in this plan, such as constructing at least 50 miles of sidewalks and 25 miles of high-comfort bikeways each year, redesigning 10 locations on the high injury network every 2 years, and implementing reconstruction the following year, determining vehicles' speeds that are safest for all people, using the street, and then designing the street to support that speed, evaluating every city roadway reconstruction project for multimodal safety needs and opportunities at project inception, and implementing a citywide communication campaign on street safety to celebrate the reality that people use different modes of transportation to get around Houston. I call on city departments to continue working collaboratively to ensure that this plan isn't just another document, but that it delivers transformational change to our streets, ensuring safety for everyone. The city believes in safe streets, and we hold ourselves accountable for implementing this plan. Lastly, together we can create change. Together we can shift how we see mobility and not only see the vision, but make it possible. No loss of life is acceptable on our city streets and highways, none, absolutely none, zero. Now let me welcome the Planning and Development Director, Margaret Wallace Brown, to tell us more, and then the other speakers will follow directly after her. Oh, and Councilmember Carla Cisneros. Thank you. She biked in. Okay?
Thank you, sir. Thank you, Mayor, for your stalwart support of this plan. This plan would not be released today if it were not for Mayor Turner. When I took over as planning director a few years ago, I had been aware of Vision Zero for a number of years. There had been talk among the Public Works Department around planning about Vision Zero, but no one had taken the step forward to bring it to the mayor. The answer when I asked the question why was, it's not something Houston would ever consider. And I asked back, are you sure? Have you talked with our mayor? I knew Mayor Turner was interested in safety for Houstonians, putting Houstonians' lives first. So we presented the plan, the idea to him, and he immediately embraced it. He embraced the idea of putting safety before other things for Houstonians. That's why we are here today, is because of his support for this. This is a special day for Houston, and it represents the best of what we as public servants do, making a safe place for all Houstonians. I want to take just a moment and thank and recognize some of the team who worked diligently on this plan throughout the whole process. Our city's chief transportation planner, David Fields, another planner in the planning department, Lauren Grove, and another, Brian Smith, were the 3 team members who really put this plan together, who worked with the community, who worked with the agencies, who worked with the other departments. As the mayor said, this was not a city only. We had partners from across the spectrum, and many of them are here with us today, and I thank them. And so one of our partners, one of our strongest partners, who was Public Works and the police department, are both here to speak, and I'm going to hand this off to Director Haddock and let her take it from there.
Thank you. Thank you very much. Thank you, Mayor. As the department that's going to transition many of these, the action plan into action, I am excited to be here today as we take these next steps. Houston Public Works, our purpose is together we create a strong foundation for Houston to thrive. And that includes all people, all commuters, all users of our infrastructure, whether you're in a car, on a bike, on your feet, or rolling. Everyone deserves a safe commute. Houston Public Works is already implementing part of our Vision Zero action plan. We evaluate each roadway during reconstruction during a CIP project to address the safety needs of all users. Our plans include adding wider sidewalks than we traditionally have, and in many areas, shared use bikeways. Once these reconstruction projects are completed, the community will notice new color-coded crosswalks, curb ramps, sidewalks, so that intersections are safer for everybody, that they clearly communicate to people in cars, people on feet, and people on bikes, how to use the intersection safely, and they're more functional for everyone. As we rehabilitate roadways citywide in the Street Rehabilitation Initiative, we're not only just looking at the pavement surface, we're actually including the sidewalks, we're adding curb ramps. We're making sure that where things are missing, that we're addressing those and improving accessibility. We'll examine and make changes to signal timing to maximize safety for people crossing intersections and all commuters. We will focus on leading pedestrian crossings and protected left turns for making all traveling public safe. We are committed to implementing Vision Zero's plan of constructing 50 miles of new sidewalks each year and installing 25 miles of high-comfort bicycle facilities on city-owned streets or city-owned land. We're also committed to redesigning the high safety intersections that are identified and shown underway. We can make our streets safe for everyone. The goals of Vision Zero are straightforward: to create safe, equitable, and accessible network of streets, make walking, rolling, and biking safe, make connecting to transit safe, and to make driving safe. Public Works putting the infrastructure as the foundation for this is an important part of this, but it's also an important part for everybody to behave and to follow the rules and things as they're going through this. And in particular, I always want to emphasize, when we are actively constructing and you're in a construction zone, things are not in the places that you normally see them. Things look different than they will when they're in the end. We have construction barrels, we have barricades, we have workers in the right-of-way, we have construction equipment in the right-of-way. And part of Vision Zero is behaving when we're in active construction. And so I ask each one of you to make sure that as you come into these areas that you're paying special attention to what's going on in that. Because at the end, we're going to have a better project for everyone to use. But in the in-between, there's a lot of uncertainty as things change on a daily basis. And lastly, I will say that we encourage you to let us know if you notice anything. We're always available to answer questions. We're always available to address concerns. We have decades of infrastructure that was built the way it was built, and it's going to take time to get through our city to improve it. But we are here every single day to work with you to identify those areas that we can make improvements and those areas that we can continue to make it safe and achieve Vision Zero. With that, I'm going to invite my colleague Gabe Caceres up from the Mayor's Office of People with Disabilities.
Thank you, Director Haddock, and thank you, Mayor, for your leadership. This is an exciting day for the City of Houston. People with disabilities rely on multimodal transit for our independence, to enhance our independence. People with disabilities, particularly those in wheelchairs, are 5 times more likely to be killed in a vehicular accident in an intersection. So this is an exciting day for people with disabilities, and this is an exciting day for those of us who live at the intersection. People with disabilities are low income, are people of color, are LGBTQ people. This will benefit everyone. So I am very excited and I'm very proud to have worked with Director Wallace Brown, Director Haddock, the rest of the team, under the leadership of Mayor Sylvester Turner, to build a more equitable and accessible Houston for everybody.
Good afternoon. Thank you, and thank you to our fellow directors for your leadership and for your partnership, but and for our mayor and council. Mayor, I want to just thank you on behalf of first responders in the communities that we serve. This is an intentional effort on your part to say that we're not doing well enough, that we need to do better. And when you think about the fact that first responders are the most vulnerable because we're on the roads at all times and your crews are on the roads at all times, I think it's really important that we take this step. We have been on board and supportive of the mayor's vision, Vision Zero, since the beginning of this concept, this is the beginning of this project, and we're proud to be partners with our sister agencies. Unfortunately, we see the effects of these crashes. Like the mayor says, these are not accidents. These are not accidents. Rarely is a crash the result of a mechanical failure. That is a rare, rare occasion in our city, in our state, in our country. Is 99 times out of 100, driver decision, driver judgment, or driver lack of judgment. HPD absolutely stands with the mayors and saying, and our partners, and saying this is unacceptable, and they can all be prevented. When we talk about prevention, it's easy to put the responsibility on the driver, the pedestrian, the cyclist. We tell them to be aware and travel safely, and everyone does, or many do, to adopt safer behaviors. But Vision Zero is really about taking and lifting up the ante and raising the ante to take a closer look at what we as a city, under the leadership of Mayor Turner and his council colleagues, can do to make our community safer. This action plan specifically points out safe speeds, and I will be honest with you all know that I'm a Texan now, but we still have, in this state, speed zones in neighborhoods that are 30 miles per hour, 35 miles per hour, when in a lot of other states, it's 25 miles per hour. And the reason we know this is because when you're walking in these residential neighborhoods and you see a car going 35 miles an hour, it feels like freeway speeds. And quite frankly, when we have this young city that we have here, and children playing, and children walking, and vulnerable roadway users, I am so heartened, Mayor, that your plan includes trying to reduce the speeds in our streets, because that will absolutely save lives. And I know that there's no Houstonian, we know that there's no Houstonian that wants to kill or injure a child or a vulnerable roadway user. And so we will continue to do our data-driven approach to address speeding in our transportation network, and we will do everything it takes to try to save lives. And we join you, Mayor. We're really proud to be part of your effort. Let me just say this, because I think it's important to know that in the last couple of years we saw some increase, but as it relates to this year, so far, we've seen a 13% decrease in pedestrian fatal crashes. And I think that's a big part of your team and the mayor's efforts to have smart crosswalks and things of that nature. We've seen a 33% decrease in bicyclists. And once again, that's another subset of our vulnerable roadway users. So we are excited, Mayor. And again, thank you, because without your leadership, people would say, well, why didn't it happen? Well, it took a man with vision, and I think a team that cares, and we're proud to be here with you today. Thank you all.
Look, and let me thank the council members because they have been pushing forward on all of these initiatives. And so the Houston Vision Zero Action Plan is a combination of a lot of people working collaboratively together to make it work. And this is just the beginning, not the end. So on that, we'll take, if there are any questions as it relates to the Vision, Houston Vision Zero Action Plan, we can take those now before we segue into the coronavirus. Any questions on the?
Can we just get something in Spanish?
Yes. Let me see, where do I want to start?
We can start. Did you want to do a rendition of Feliz Navidad together, Mayor? I know. Just very quickly, le quiero dar las gracias al alcalde Turner por su liderazgo y a sus colegas en el concilio de la ciudad. Sabemos que en esta ciudad, desgraciadamente, muchas personas mueren en las carreteras, y cada una de estas muertes, como dijo el alcalde, no son accidentes. Son incidentes que podemos prevenir si estamos usando nuestra cabeza. Y este plan, con nuestros colegas de los otros departamentos, estamos seguros que vamos a salvar vidas, y pues no hubiera pasado sin el liderazgo de nuestro alcalde y sus directores que están aquí con ellos, y también sus colegas en el concilio. Así que estamos contentos, sabemos que estamos pensamos que vamos a salvar vidas. Y el fin del día, darse de cuenta que en el estado de Texas, en los lugares, las zonas residenciales, los vehículos pueden manejar a 35 millas por hora. 35 millas por hora en unas callecitas que son muy pequeñas y eso es muy peligroso. Y parte de este plan que el alcalde está poniendo va a bajar la velocidad. Estamos seguros que vamos a salvar vidas y vamos a estar todo mucho más seguro. So, is that good? Very much. Thank you very much. I said a lot of nice things about my mayor, and I think you can translate that.
Sí, es bueno, es bueno. And Councilmember Robinson, did you want to add in Spanish just a little bit?
En español, lo que es muy importante que dice el chief y también nuestro alcalde es que en las zonas residenciales que tenemos unas velocidades de nuestros vehículos que son más tranquilos, que cuidamos por nuestra juventud, los niños que están jugando en las calles y también que estamos más disponibles en todas maneras con nuestras obras del público. Y por eso este programa está muy importante a todos nuestros departamentos y la gente de Houston y también tenemos muchos compadres en la región que estamos empezando este programa juntos. Pues, alcalde, gracias por la empieza de un programa muy importante por la zona nuestra y gracias a todos en el año nuevo.
Muy bien, muy bien. All right. Any other questions on the vision before we shift?
Yeah, Mayor, just the state obviously is engaged in a similar program to bring down
Yes.
fatalities. How are you integrating this with what the state is doing? Like if people see something else, let's see, in the region but not in the city limits, can you help, if you go through the process to go through your reporting, does that also integrate with or do you get referred to calling the state or how?
Carol, you want to, which one? Margaret, Carol? Because I know the TxDOT plan and this plan, they go hand in hand.
The beauty about this plan is that it's fully integrated, not only with the state of Texas, but with Harris County. All of the plans build on each other and really address the same data, and so look for ways that each of the agencies can contribute to Vision Zero based on the data that we have across the region.
I will add the second part of that, which is if somebody sees something and they call 311, but it's not in the city, we all have direct partners that we work with in every single one of these agencies, and we call directly over and say, hey, this is what we received, here's what it is, and we ask them to hand it off and hand the person to the right person on that side. We don't just say, we'll call the county. We actually make that connection and get the problem into the right hands.
Okay.
Yes.
I just want to echo some of those sentiments for what we're doing with our partner agencies, especially with TxDOT, some of the programs we've heard about the local streets, but also the Highway Department, TxDOT. Our regional commissioner is Laura Ryan, and the regional director is Eliza Paul, our partners for a number of projects right now, that this wouldn't be standing alone if we didn't have great collaboration currently with all the agencies.
All right, thank you all, and we're going to segue now to the coronavirus report. Thank you very much. Okay, let me just give these quick numbers, and then I'm going to turn it over to Dr. Peirce to elaborate even further, and then Chief Acevedo will come and give some numbers as well as relates to HPD. Today, we are reporting 1,514 new cases of COVID-19. That's the highest number that we've reported in a while. So it's 1,514. I would like to think that this is coming on the back end of any surge from the post-Thanksgiving celebration, and that hopefully we will start to see these numbers to plateau, and then we'll start working down. That is my hope. But 1,514 new cases, that will bring our total count in Houston to 107,156. There are 3 newly reported deaths as a result of COVID-19, and that brings the city's total to 1,496. Yesterday, we didn't report any. There were no deaths reported yesterday, and today we're reporting 3. Even though it's one person too many, but when you compare, for example, the number that was reported yesterday, I think was close to 3,000, a little bit more. Houston, we reported 0 in that number, and today we're reporting 3. Let me simply remind people that the positivity rate as of this week in the city of Houston is 10.5. That is up from 8.8% last week. And so again, this is another number that I would like to see plateau, hopefully at 10.5, and then start working that positivity rate down. The numbers in our hospitals as of today is a little more than 1,200. And so again, it continues to kind of inch up. And again, we'd like to see that number plateau and then start to work itself back down. So even though there's a great deal of excitement, justifiably so, in the city, with respect to the vaccine being distributed to our healthcare providers, I do want to remind people as we get closer to next week that please keep these masks on. Please keep your holiday celebrations to a minimum, okay? Do not be attending these, what I call holiday parties by companies or organizations or family members. Let's bear in mind that this virus is very much active within the city of Houston. So keep your parts small to the people that you are in the household with every single day. And let's avoid large gatherings. And again, if you go into some place and it's crowded, let me encourage you to turn around and back up and go someplace else. Not telling people not to finish their shopping. I'm simply saying do it in a safe manner, okay? Just do it in a safe manner. We're walking a very delicate line between making sure we do everything to keep people safe and at the same time keeping our businesses open and people with their jobs. But if we wear our masks and wear our masks in a very large percentage, then we can keep our numbers in the range where the numbers are manageable. So let me simply encourage you to do that. I do want to thank Houstonians across the board in general for having done that, because relatively speaking, when you look at the numbers, even though they've gone up in a way that we've been able to manage the situation. Our healthcare delivery system has not been overwhelmed. We don't want it to become overwhelmed. And in order to prevent that from happening, it is important that you mask up until such time as you can get the shot in your arm with the vaccine. I just can't tell you how giddy people were at the hospitals yesterday getting the vaccine. I've never seen grown people just be elated with getting shots. But they were elated with getting shots. And then I've never seen people elated to see other people getting shots when they couldn't get the shots. So there's a light at the end of this tunnel, but you want to get to the end of the tunnel. So stay healthy, stay safe, so you can get through the end of the tunnel and then come out on the other side, okay? Having said that, let me pause and bring up the Chief Medical Officer, Dr. Purse.
Thank you, Mayor. So the mayor did point out that we did have a comparatively, compared to the last several days, certainly a large number of new cases reported today, and we do believe that this is probably related to some degree to the post-Thanksgiving. And it's a little bit hard to say for sure because certainly at Thanksgiving, we saw a lot of people on Thanksgiving Day and that weekend after. A lot of people didn't go to get tested, and then the following week, people started going to get tested. And so some of it is we need to take it in context of how many people got tested and when they got tested. But nevertheless, it doesn't matter. I mean, we can talk about that from an academic standpoint. But the bottom line is 1,514 new cases, and 97% of those are from the last 14 days. So that's a lot of new cases, right? And in addition to 3 newly reported deaths, I want to point out that all of those deaths are within the last 2 weeks. If you look at the dates, the furthest back was December the 4th. So those are recent deaths, and we've had problems in the past with some of the death reporting being greatly delayed. But these 3 people, one of them had an age probably not dissimilar to mine. And so, this needs to strike home. A lot of us need to pay close attention. I still think that there are some folks who think that, it's all old people that are dying, and they have a mental picture of a person in a nursing home with lots of other illnesses. That's not the case. Remind folks, we've had police officers and firefighters and a lot of other people who were able-bodied and at work and had families who cared very much about them that have died. And we had even more people who just wound up in the hospital for several weeks with very scared families. So let's not lose sight. The mayor has pointed out that there is light at the end of the tunnel. Now is the time for hope, but it is also the time for us not to drop our guard. And then one last thing I just want to point out is I'm seeing more and more the folks who are wearing these face shields and not wearing masks. And I want to reiterate, and I ask the folks in the media to please take that as a message and make a story of that. Those face shields do very little to protect anyone from anything. They are an addition. If you're wearing a mask, a cloth mask, that mostly protects the people around you. It does protect you some, but it mostly protects the people around you. A clear plastic shield, your exhaled air goes everywhere. So it doesn't protect anyone around you. All it does is it really protects you from some splatter that might come from somebody else's face or their mouth if they're coughing or whatever. And let's face it, we all know we've been talking loud and stuff, and all of a sudden you see a little something fly, right? That's what it protects you from. So in essence, those clear face shields, they're not, we should consider them not effective at all when you compare them to the mask. So I would ask the media to take that message forward and let's try to help our neighbors.
Thank you, Doc. Thank you, Mayor. Just give a quick update of HPD where we're at. We're fully operational and able to respond to everything. Since this started, we've never not been able to stay fully operational and respond to all calls for service. As of today, we have 264 employees that are out because of COVID-related issues. That's a total of 264. 253 are quarantined due to illness, and that's 228 classified uniformed members of the department and 25 civilians. To date, we've had a total of 789 employees that have been positive for COVID, and fortunately 634 have come back to date. En español, quiero que sepa la comunidad que el Departamento de Policía de Houston sigue pudiendo ir a cualquier llamada y mantener la seguridad pública en esa ciudad. Hoy quiero reportar que tenemos un total de 264 empleados que están fuera de servicio por el COVID, 228 oficiales y 36 civiles. El alcalde Turner reportó hoy que desgraciadamente hoy tenemos 1,514 casos nuevos del COVID-19 para un total de 107,156 personas que han cogido el virus aquí en la ciudad de Houston. Y también hoy reportó el alcalde que tenemos 3 personas más que murieron por el COVID, por un total de 1,496 personas. Y desgraciadamente, ¿se acuerdan que el alcalde quiere que el ratio de positividad sea menos de 5%? Y estábamos esta semana a 10.5% comparado a 8.8% el mes pasado, la semana pasada. Así que es muy importante que sigamos persiguiendo todo lo que le está pidiendo el alcalde y los doctores, las máscaras, las manos, y más importante, vaya y tome el examen del COVID, que hay muchos lugares que no puede hacerlo de gratis, porque usted puede estar enfermo y no lo sabe, y aunque no le perjudica a usted, puede morir un familiar o un vecino o un amigo si le da el virus porque no sabía que usted lo tenía. That's all I have, Mayor. Thank you, sir.
Then let me also say, finally, before we take any questions, just like before Thanksgiving and leading up to Thanksgiving, I want to encourage people to kind of stay put. Again, discouraging people from traveling all over. Again, we're still in the midst of this virus. Positivity rate in the city of Houston is still increasing, and quite frankly, the positivity rate across the country is still high. So let me encourage people I know when it comes to Christmas and Hanukkah and Kwanzaa, that people want to get together. I mean, it's the nature of the holiday season. But again, I'm just asking people to kind of be patient, hold on, and let's get through this year, 2020, and then we can really party when it comes to 2021. So just bear in mind at City Council, we declared 2020 already gone, over. So, don't worry about next week. We're just going to put it to next year. Okay, we'll stop and take questions. You can send it to any one of us that's up here.
Okay, maybe Dr. Peirce is the one to ask this about, are you up to speed on what the status is of ICU beds and staffing in the medical center during this particular surge?
Yeah, so we have two sources of information we look at. So the Texas Medical Center provides us data daily, and the mayor gets it as well. Looking at the hospitals, the number of beds that are available, ventilators, how many people are in the ICU with COVID versus how many people are in general beds with COVID disease. We also have another source of information, which is the SETRAC webpage, which looks at it by county. So the TMC site has all of the TMC member institutions across their entire region. Those hospitals actually go out into a 9-county region, and they don't include all the hospitals in Harris County. So we look at two sources of information that report very similar data, and what we're finding is they're both trending in the same direction, and that is that about 25% of the folks that are in the ICUs, both in Harris County and in the TMC member hospitals, somewhere in the neighborhood of 25% are diagnosed with COVID, and somewhere in the neighborhood of 10% of those in all the hospital beds, or the non-ICU beds, I should say, are diagnosed with COVID, and we're seeing that in both sets of data. And we've also seen that it has been gently trickling up over the last 6-8 weeks or so.
As far as I think you've mentioned this some before, but the rollout of the vaccine after obviously the health workers, you have first responders within the city of Houston who are obviously going to be getting it at some point. Is there any kind of timetable you're envisioning at this point?
Yeah, so this is a great question, and it's challenging because two things are going on simultaneously. And one is that the state is still working on the prioritization beyond the first, the Class 1A. So they're still working on that prioritization. And then whatever that prioritization winds up being, we have to get the logistics and the strategy to get those vaccines done. So that's real time happening. So, and then the third thing, of course, is how quickly vaccine comes into the community. So those three things are occurring at the same time. So what you're asking me is, when do I envision? And so so it kind of depends on which group of people you're talking about. And I think you said first responders?
Yes.
So I would be hopeful that we could get some first responders to get vaccinated by the end of this month, but that may not happen. There's been some change in the amount of vaccine that came in versus what was expected. And the Moderna is going to be coming online pretty soon here. So that's another sort of wild card in terms of how soon we'll get vaccine in the community. So I'm hoping first responders by the end of this month, but it wouldn't surprise me at the least if it isn't until sometime in January.
What about vaccinations for city leadership? Is that, where would that fall in line?
So I anticipate that will, that would be with the, the critical infrastructure personnel, which would be another prioritization that we're waiting on the state. They've not said that yet, so we have to wait for that comes out. But that would be the critical infrastructure personnel.
Okay. Go ahead.
For the mayor, this is in regards to the HISD case numbers.
Oh, I thought you would say you wanted the mayor to get his shot.
We've seen schools across HISD increase in numbers for COVID after Thanksgiving, and they have winter break coming up. Is there anything the city is doing to help mitigate the situation in the districts, the health department?
Well, the city, the doctors with the Texas Medical Center, Marvin Odom, who is the chief recovery officer, that entire team have been meeting with the superintendents on a regular basis, providing them with advice, recommendations on how to proceed. All of us are trying to do our very best to keep kids at school as much as possible, especially in light of the impact of them not having in-person learning is having on their schooling. So we're working very carefully, with them. But there's a team that meets on a regular basis with the area superintendents.
And I guess what would be your message to parents going into the winter break? I know you mentioned the traveling and all of that.
Well, certainly, I discourage, in the strongest of terms, people traveling all over. I discourage that. Can't tell you not to. I can't prevent you from doing it, but certainly I'm recommending that people minimize their traveling. Secondly, even if you're staying in town, I would encourage you to keep your part small to those people who are pretty much within your household. And I'm certainly discouraging any big holiday parties, events, whether away from your home or at your home in the backyard. Just keep those numbers very, very small. Wherever you are, if you're in the midst of others, especially outside of your part at home, is to keep your mask on. That's very important. Until you get the vaccine, and even when you get it, but certainly until you get it, the mask becomes your vaccine. And then recognize there's going to be a break. And so you don't want to behave in a reckless, irresponsible sort of manner, knowing that, school is going to be, you're going to return back to your workplace, or you're going to return to the classroom on the other side of January. So what you do between now and the end of the year will certainly have an impact on the status of this virus after the fact. The goal for us now in the city of Houston is to do everything we can to blunt the increase of the positivity rate of this virus, to blunt the number of people that are needing to go into our hospitals, to start to bring those numbers down. Now, what we are seeing is that, for example, in the Midwest areas, they are starting to see some improvement. Even in El Paso, they're starting to see some improvement. What we don't want to see, and I don't know if Dr. Percy can speak to this, what we don't want to see is that as those areas in the Midwest, their numbers start to get better, that our numbers get worse. Okay? We don't want to see that, which means that we can't let our guard down, and we still have to be mindful that even as the vaccine is being disseminated, that we have to be very focused on doing everything we can to prevent the virus, or not to provide fuel to the virus. Let me put it that way. And what provides fuel to the virus is the proximity of people with one another. We don't want to do that. Okay? All right. Anything else?
A non-COVID question for the chief, please.
Oh, sure. That's a non-COVID.
There's some interest in it if you have a reaction to the arrest of former HPD Captain Mark Aguirre for aggravated assault with a deadly weapon in his, you might say, ill-fated voter fraud investigation?
Yeah, I could just say that any notion that the arrest and the investigation was political is absolute nonsense. Our police department encountered this incident months ago or weeks ago, and we took his allegations seriously, and actually we investigated his allegations. We conducted a thorough investigation in conjunction with the District Attorney's Office of Harris County, and I know that Precinct 1 also conducted an independent investigation, and none of us found any evidence of what was alleged. But I also want to be real clear. He has not been a member of the Houston Police Department since 2003. He was actually fired from the Houston Police Department in 2003, and I'm not quite sure it's fair to keep referring to him as it's almost like he was here a week ago. No, he's been gone for many, many years, and we will put up our investigation to scrutiny, and we're looking forward to trying this in court and not in the court of public opinion or in the media.
Just the fact that he is a former law enforcement officer, does that particularly add to the how disturbing this might be as a case to you?
Well, I mean, he's been gone for a long time. I mean, he's been gone since 2003, and I just think that it's important for us to stop talking about this election when we keep seeing people that are being threatened across the country to cast aspersions on an election system that may not be perfect, but it's second to none, and we're supposed to be the beacon of hope for the rest of the world and an example. I think that when people look at the way that we investigated this incident from beginning to end, they will see that law enforcement has been vigilant. We've been vigilant in terms of any allegations of criminality, including voter fraud, here in Harris County. And quite frankly, we're very proud of our efforts. And this man's, he's going to have to face his case in court, and we'll see what happens from there. Okay, thank you.
All right, let me say, enjoy the holidays. Let me just do that, enjoy the holidays. And I do want to emphasize, and I think Councilmember Cisneros said it earlier today, when we are saying social distance and all of that, it is about the physical separation, but do find ways to stay connected to people during the holiday season. It can be rough even in the absence of the pandemic. If you need someone to talk to, if you're feeling stressed, the anxiety, and you need someone to talk to, remember that the hotline remains open, 713-999-9442, from 1 p.m. to 11 p.m. So if you feel stressed out and need somebody to talk to, there's nothing wrong with picking up the phone and having a conversation. But enjoy it. And then if you really get down and you want to be encouraged, just find my number and I will sing a song to you. And let me give you a verse or two right now that I've been... Yeah, Feliz Navidad, and da-da-da-da-da, all of that. Okay, happy holidays, enjoy it, and then stay safe. Stay safe. The vaccine is on the way. And Dr. Purse, I said I was going to get my vaccine in public. You want to give it to me now?
I wish I could, Mayor.
You don't have it?
I don't have it, sorry.
You know, we just, no special treatment for the mayor. All right, thank you all.
You've been a good boss.